Welcome to my yoga class. I am Dr. Sanjay Raghav, a neurologist practicing in Melbourne, Australia. My special interest is movement disorder, which include Parkinson's disease, and this yoga program is developed for Parkinson's patients. I'm also a level 2 yoga teacher in Australia, teaching yoga to my Parkinson's patients for the last few years. I'm associate professor at RMIT University and Monash University as well, and where I do a lot of Parkinson's research, which helps to get new treatments and new modalities to understand Parkinson's disease. Let's start the yoga practice. The first part of this is loosening exercises. We'll start with our hands. Move your wrist up, down, towards each other, away, towards each other, away, keeping your elbows straight. Now make a fist of your hands with thumb inside your palm. Make rotations across your wrist, clockwise and then anti-clockwise. Then close and open your fist. When you open, exhale. When you close, inhale. Open, exhale, close, inhale. Let's do some shoulder movements. Rotate your shoulders up, forward, down and back, up, forward, down and back, and then reverse. Have a big rotation. In Parkinson's, we should remember to take big movements. Now put your hands on your shoulders, elbows together, make a big rotation of your elbows. Bring them forward, up, back and down, forward, up, back and down, and then reverse. Again, big shoulder movements. It helps to decrease shoulder stiffness, frozen shoulder, improves your posture. Now we'll do some isometric neck exercises. Push behind your head, front, sideways, and on your chin. This helps to strengthen your neck muscles, decrease your neck pain. Do it every day. Now we'll do neck rotation. When you go back, inhale, coming forward, exhale. Go back, inhale, coming forward, exhale. Touch your right ear to the right shoulder. Try to bring your left ear to the left shoulder with gentle and relaxed movements. But try to have a big movement. Try to bring your chin to the chest and then your head back, touching your neck. Let's do the leg movements. Start with your toe movements. Move your ankle forward, back, back. Have a gap between your legs. Bring your toes together, away, together, away. Good stretch to your legs. Make a big rotation across your ankle. Try to touch the side of your feet to the mat. In Parkinson's, we should remember to take big movements, then reverse. Fan out your toes, stretch out your toes and relax. Stretch out your toes. Tighten up your kneecap and relax. Tighten up your kneecap and relax. Bend your right knee. Big rotation across your knee. And then reverse. Left leg. Again clockwise. And then anti-clockwise. Do a couple of sets of each movement. Lie down on your back, nice and relax. Just watch your breath. When you inhale, the abdomen goes up, and when you exhale, it goes down. So chest and abdomen goes up with inhale, The body goes up, and when you exhale, chest and abdomen goes down. Arms on your sides. Lift your right leg up, knees straight. Go up to 90 degrees and make a big rotation. Cross your hip. Try to bring your heel close to the mat. Again, focus on big movements. With normal breathing. And reverse. Do it with the left leg. Lift your left leg up, knees straight, 90 degrees. And again, make a big rotation. Try to bring your heel close to the mat. Clockwise movement. Normal breathing. And then reverse. Anti-clockwise. Feel good stretch across your groin, across your hip area. Now bend both knees. We'll do the lumbar stretch or the spinal twist. Both knees to the right, face to the left. Left ear touching the mat. Right knee on the ground and left knee on the top of it. Feel the twist in the spine. Feel the squeezing of the internal organs. Do it on to the other side. Knees to the left, face to the right. With normal breathing. It is good for spine flexibility. It also helps with good regulation of internal organs as they get squeezed out. Toxins are released and the fresh blood goes into the internal organs. And a good massage to all the abdominal organs. Try to do most of the postures with your eyes closed. Now bend your right knee, hold your right knee tight to your chest. It is Pavan Mcdonough, the wind releasing pose. Try to touch your forehead to the knee. When you do it, you exhale and you bring your head up. And then loosen your grip and do it with the other leg. Bend your left knee. Hold your left knee with both hands. Squeeze it tight to close to your chest. Then exhale. Lift your head up. Try to bring your forehead close to the knee. Stay in that position for the count of 10. And then relax. Again, repeat it on the other side. Pavan Muktasana, wind releasing pose. Now we'll do with both legs. Bend both knees. Hold both knees with both hands really tight to your chest. Then do rock and roll forward and backward. Come up to the sitting position and then bring your back. This is really good for all the internal organs. Helps to release the wind, and it's a good exercise for your spine. Now we'll do the bridge pose or Setu Bandhasana. After bending your knees, you lift your chest and abdomen up. Keep it as high as possible and try to move your feet forward. Try to move them forward as much as you can, keeping your balance. So only your shoulders and neck are supporting from the top and feet from the below. Arms on your sides, palm facing downward, and gently relax and go into Shavasana or the Cobra Pose. Just here watch your breath again. Inhale, body goes up, and exhale, body goes down. Bend both knees again, and we'll do the Sarvangasana or the shoulder stand. So both hands are supporting your back, legs straight, chin tucked to your chest. Sarvangasana is considered to be one of the best asanas for neurological disorders like Parkinson's disease. Once you are into the pose, stay still in that pose for a few minutes. And gently come down from shoulder stand. And go into the Shavasana. Now we'll go into the prone position. Chin on the mat, arms on your side, feet together. Now try to stretch your chin as much as you can. Feel the stretch across your neck. This helps with activation of your thyroid gland and parathyroid gland and the neck muscles. Now we'll do the Cobra Pose or the Bhujangasana. Bend your elbows, palm facing forward, and lift your body up to your navel and try to look up towards the ceiling. Stay there at least for the count of 10. This is really good for your back, for your abdominal organs, and for your core muscles. Go into the prone relaxing pose called as Makarasana or the crocodile posture. You bend both elbows, one hand on the other, cheek on your hands, feet apart, toes pointing outward, and stay in the relaxing pose for a while. It's important to relax in between the poses. Now bring your feet together, arms on your side, and we'll do the Dhanurasana or the bow pose. Hold on to both ankles with your hands. Lift your chest up, legs up. Try to have minimal contact with the floor. Gently roll to your side. This gives a good massage to the internal organs. It helps to decrease the belly fat and improves your spine flexibility. Now we are again going into the relaxing pose, Asana. Right arm and leg are straight. Left knee is bent, left elbow is bent. Face on one side, chest on the floor, and just be relaxed. Come back to the prone position. Now we'll do the lifting of alternate arm and leg. Bring your right arm up and left leg up. Try to keep it up. It helps with the balance, improves endurance. Again, go into the relaxing pose. Do it again on the other side. Lift your left arm and right leg. Head up. Stay in this position for a count of 10. And again go back into the relaxing pose. Now roll onto your right. With help of both hands, come into the sitting position, into the comfortable pose or Sukhasana. Legs folded. This is Vajrasana or the diamond pose, in which you sit on your heel. This is the only pose asana which you can do after having food. It helps with digestion of food. This is again, we are back into the comfortable pose with hands in Gyan Mudra. Now this is Siddhasana, in which one heel is on the top of other. This is good if you are meditating and you have to sit for long hours. This is Padmasana, in which you cross your legs one over the other. Now I am going to show you Vayu Mudra, in which you bend your index finger at the base of thumb and you press your index finger with the thumb. This is good in Vata doshas, and Parkinson's disease is one of them. If you can stay like this when you're watching telly or doing something else, that would be quite beneficial. Now we are going into the butterfly or the Titli Asana. This is really a good exercise to stretch out your groin and hip area so you can sit comfortably in Sukhasana or in a squatting position when you're doing different poses. There are other exercises to stretch out your legs. Bend your right knee bring it close to your chest, to your head, and bring down, and then stretch it up and down. Touch to your knee, down, touch your knee to the head and down, and then bring it outward and forward. These are all stretching exercises for your legs in sitting position. Now we'll go back into the Vajrasana or the diamond pose, and we'll do Shashank Asana, in which you bring both hands back. You're holding your right wrist with the left hand. Inhale, and while exhaling, bring your head down. Try to touch your forehead to the mat. Shashank Asana or the forward bending pose. Slowly inhale, come back to the Vajrasana, the diamond pose. And do another set of it. This is a very good exercise to improve your digestion. Now we'll do the breathing exercises. We'll start with Kapalbhati. In Kapalbhati, there is forceful exhalation. You can do 1 per second. You can go up to 2 per second. To know exactly what's happening, you can put your hand on your tummy, and when you exhale, it should go in. So there's forceful exhalation with passive inhalation. So you just have to focus on your exhale. Do it at least for a minute. Now we are doing abdominal breathing. When you breathe in, the abdomen goes out, and when you breathe out, abdomen goes in. You can check that with your hand as well. Now the second part of sectional breathing is thoracic breathing or the chest breathing. When you breathe in, the chest expands, goes outward and lateral, and when you breathe out, it goes in. Third part of sectional breathing is clavicular breathing, in which you move your collarbone up and backward to inhale from the topmost part of the lungs. Now we'll do the complete breathing or the yogic breathing, in which we take help of abdomen, chest, and collarbone. Deep inhale and longer exhale. When you inhale, the body goes up, the chest expands, and when you exhale, it goes down. Now we'll do alternate nostril breathing or Nadi Shodhana Pranayam. This is the position of your fingers. You close your right nostril with the right thumb. Inhale from the left, exhale from the right. Close the left nostril with your ring and little finger. Inhale from the right, close the right nostril with your thumb, and exhale from the left. Inhale from the left, close the left nostril with both ring and little finger, and exhale from the right. While you do this, have a pause between inhale and exhales. Sedanta or cooling pranayam decreases BMR, should be done in summer months to bring some coolness to the body. Now we'll do the standing poses or asanas. The first one is Dharasana or the mountain pose. So you join both hands up, go on your toes, stretch your body up. And to improve your balance, you can also walk on your toes forward and heel backward, keeping your arms stretched out. Now we'll do Ekapada Hastasana, which is foot hand pose. So you bend your knee, hold your foot with both hands and try to stretch up as much as you can. Keep your balance. Stay in this position at least for 10 seconds. Now we'll do Ardha Kati Chakrasana or half wheel pose. You inhale, bring your arm up at the level of shoulder. You turn your palm upward and then turn your body towards the left side and then gently bring it down. Do it on the other side. Turn your palm upward at the level of shoulder, stretch your arm straight up and then lean your body towards the opposite side. Feel the movement of your right hand sliding down to the side of the right leg. Stay in that position for a while and then slowly come back. Now we'll do the Digestive Fire or Agnisar Kriya. It improves the digestive fire. Open your mouth, poke out your tongue, inhale and exhale from your mouth, and your abdomen is going in and out. Completely exhale, don't breathe. Bring your abdomen in, out, in, out, in, out quite fast. It improves your digestive fire. Now we are doing Bhramri Pranayam, in which you roll your tongue out, up, touching your tip of the tongue to the hard palate. And you make a humming bee sound. Taking a deep breath in. We do 9 rounds of it. When you say focus on vibration in your legs up to the waist. With O in your abdomen and chest, and with Ma, neck and head area. Feel the vibration moving through your body. Your hands can be in Vayu Mudra. We have acupressure points in our palm of the hand, and pressing all the acupressure points helps to heal our internal organs. So press all these areas with your thumb. And now we'll do the star jumps, which again helps to do an aerobic exercise, but also pressing our acupressure points in our hands and our sole of the foot when you jump. Now this is Vipreet Karni Asana, or the reverse action as the body is upside down. This can be done if you can't do a shoulder stand or Sarvangasana. It has same benefits as shoulder stand. Much easy to do. You can take help of the wall and you can stay in this pose for a few minutes. Now we are doing meditation walking, in which you try to focus on each step, touch of your heel, sole of the foot, toes, lifting of the leg, movement of the opposite arm. Just be in the moment. Focus on your walking. Take long strides with full awareness and enjoy the movement. Enjoy the movement of your arms and legs, and be aware of all the movement and touch of your feet to the ground and crossing the air when you move your arms with your full awareness. Thanks for watching my video for yoga for Parkinson's. Hope you guys do it at home on a regular basis to delay the progression of the disease. If you have any queries or if you need more information, please visit us on talkparkinsons.com. We are also putting a lot of new videos on YouTube as well under Talk Parkinsons. Wish you a good health. Thank you.